Hello, everyone. Good day, good morning, good afternoon, good evening. If you are joining us from the other side of the world, welcome to Conversations in Planetary Health. I'm Dr. Renzo Guinto, Associate Professor and the lead for the Planetary Health Initiative of the SingHealth Duke-NUS Global Health Institute here at the Duke-NUS Medical School, the National University of Singapore. Today, we are very pleased that we are gathered to talk about, our food system. You saw in the title, Planetary Health Diet. You might be feeling intrigued on what's this concept, this idea. So we'll hear more from our speaker today. We're going to explore the nexus of food, nutrition, and the environment. We have colleagues who are joining us here in the room, but we also have participants joining us online. Thank you very much for being with us. The format for today's session will be, simple. We'll start with hearing from our guest speaker to be followed by a conversation. It will be great if we can hear questions and comments both from our in-person and online participants. So please, use the chat box if you have any query or comment or insight. And of course, for those who are inside this room, happy to hear your thoughts later. We're having these conversations because we now face many different pressing existential threats to human health that emanate from the global environmental changes that we see, of course, climate change. And it's important to acknowledge that we're having this conversation while COP29, the UN climate negotiations, is happening now in Baku, Azerbaijan. They have been talking about how to, save the planet so we can save ourselves. And part of it really is trying to address, the environmental challenges brought about by our existing food system, which also affects our human health, and that's why we're having this conversation. So what I'm going to do now is just to introduce briefly our speaker, who is a dear colleague, collaborator, and friend. Our speaker is actually a research fellow from the Healthy Longevity Translational Research Program at the Yong Lu Lin School of Medicine here at the National University of Singapore. He is a passionate advocate for food systems, sustainable food systems for planetary health. But also, apart from being a scientist, a researcher, he's also an entrepreneur, an innovator, and he served as the director of Adiante Corporation, an investment holding company dedicated to advancing sustainable technologies in agriculture and renewable energy. He also spearheaded investments in two startups, DataNam, CircaFeed, which focuses on innovative solutions in agri-tech to build sustainable food systems that benefit both consumers and the environment. So we'll be hearing a lot from our speaker today, both on the science, but also on the innovative solutions to address, again, the nexus of food, nutrition, and the environment. So now let's listen to Daniel Mahadzir. Daniel, thank you for joining us.
Thank you, Renzo. Let me just share my screen. Okay. So, hello, everyone. I think Renzo gave quite a good introduction about myself. So, I'm Daniel, and today I just want to share with everyone about planetary health. And bulk of my presentation would be about my prior work prior to join academia. Okay, so I have a full financial disclosure here. So these are the company that I founded and received grants and endowments from a few organizations, which gonna be presented as one of the key things in this presentation. So you might be surprised that the food that we eat and also the farm that we grow it, and finally, the landscape that we clear to grow all of this food actually contribute to climate change. And a lot of time when we talk about climate change, we imagine polar bears stuck in small piece of ice, but the real victim here is actually Earth. But when we want to talk about climate, food system and climate change, it's actually a very challenging topic because it has many different factors in work. It has full of confusion. It's also misinformation, and food could be very political. So to put everything into perspective, about 38% of our land on Earth is actually used for agriculture, and 29% of those 30 from that is actually used for grazing land to grow our animal. And to put that into perspective, only 1% of the land mass around the world is actually all the cities and suburbs combined. So the majority of land is actually used to grow our food. Food dominates our planet and animal dominates our food. So if you look into food emission, it actually consumes most of our carbon budget. We have our agreement that we want to reduce our carbon footprint and so on. The majority of it actually comes from our food emission. And if we do nothing, business as usual, we are going to use up all of our carbon budget just to feed ourselves. So if you look at this project drawdown data and then actually summarize the consumption of carbon, so you can the emission of greenhouse gas. You can see that food and agriculture land use about 22% of our emission, and then bulk of that is actually caused by deforestation, because we need to clear the land to build our new homes, to build our new farms, and so on. And that actually emit a lot of greenhouse gases. And then the most popular is methane from livestock. So we blame the cows, but actually it's really, can we blame the cow? So 5% is coming from the methane. And then you can see that industrial farming methods, where there's a lot of pesticide, fertilizers, and so on, actually contribute to the greenhouse emission. And finally, since we are Asian, methane from rice production is also one of the biggest contributors for greenhouse gas emission. So actually, when you add everything together with the indirect emission, which is the logistic part of food distribution, food waste, processing, and so on, it actually, one third of our emission comes from food. And that's what draws me to work on the food system. So you can see that global trends in food-related emission is actually growing. And, this map actually shows a very, very unfortunate scenario now, because you can see that the low-income countries actually have the biggest emission for food. Why? Because they are the producer. So a lot of big countries, they come and invest in a low-income country for farms and so on to actually produce more food over there. And the crisis of food and climate is actually a serious thing. So what can we actually do? So first, we need to cut emission. The reason why we need to cut emission is because rather than recycling, we really need to reduce. And our population is growing. And if we are not cutting emission, it's as if we have a bathtub that's full of water, and then we just keep on adding taps onto it, and it's just going to overflow. So now we just need to switch off the tap and then manage everything. So the first one that we need is actually a more efficient food system by cutting down food waste. So nearly 30 to 40% of the food that we produce actually goes directly to food waste. So that 30 or 40% of that emission from producing them is actually unnecessary. So reducing food waste actually cuts our emission. And most of the time, food waste is a very popular problem in a high-income country rather than the low-income country. And we also need to rethink our diet. We need to shape the demand, because most of the time we produce food when we have the right demand. And the reason why we're still producing cows is because there's still a lot of people wants to get protein from red meat. So, but then to put everything into perspective, when we look into coal, the cost of coal actually released about 2 to 4 pounds of CO2 equivalent, when we burn 1 kilogram of them, 1 pound of coal. But then to produce 1 pound of beef, we actually release 100 times of those. So that's actually put everything into perspective, how food is very significant. And in fact, it's more significant than energy. So you can see that a lot of time we blame the cow because of our consumption and then because of our demand. And as you can see that 14.5% of total greenhouse gas emission comes from the food that we take. So, and this graph actually put a very, very good perspective on, how animal-based food actually have a lot of, a lot of greenhouse gas emission. And you can see that as we leave the animal-based food, and then we go down to the plant-based food, it actually gets lesser and lesser. But it doesn't give the entire picture, because if you want to produce palm oil, you still need to do deforestation because you need to plant the palm. But then all the data are now blaming the red meat, right? So we can see that red meat is the most resource-intensive food and so on. That is why we come out with the concept of planetary health diet. So planetary health diet is not just a diet that's going to make you healthy, but more conscious. So you are aware of your choice on what you're putting on the plate. So as I said, majority of planetary health diet recommendation will come from food, plant-based food. And then you can see that there's one sliver of red over there, animal source protein. So we really need to be careful there, because the moment we increase the animal source protein, we also increase our carbon footprint from our food consumption. And this also, and so these are all the planetary health diet, all the breakdown of planetary health diet. You can actually read about this planetary health diet in the Lancet report. And planetary health diet is supposed to be colorful, and it's color of our greenery and our forests. And we don't actually see this kind of diet anymore in Singapore. I'm not so sure, maybe I haven't seen it, but then most of the time we don't really see this kind of food being, prepared in Singapore. Most of the time it's just a slab of meat or something like that. So the second one, after turning off the tap, we actually need to protect our ecosystem. So the existing ecosystem shouldn't be touched. So most of the time, the one that drives deforestation of us clearing off this land are commodities farming. So commodities farming are the farming practices that aims to have a shorter time, higher yield, and larger area. So in order for them to achieve that, they have fertilizer, additives, enhancer, and so on, that not just being added to the produce, but also to the soil. So these are the reason why we have a lot of problems such as AMR, antimicrobial resistance and everything, because of this chemical, leaking into our soils and also our food. So you can see that there's a lot of effort to reformulate fertilizer use, and there's a lot of country that is now focusing. A majority of it comes from, actually nearly half of it comes from Asia and the Pacific. The reason why is because we are one of the biggest food producer in the world. So I joined the bandwagon. So I told that I wanted to reformulate the fertilizer too. So I used black soldier fly larvae as one of the agent to help on creating this new formulation of fertilizer. So we have food waste. We put black soldier fly larvae, we convert them, and then after that we put it reformulate the fertilizer, and then we won an award at the World Food Forum, and it shows that it actually can be a scalable process. And then from there we actually expand the entire project, and then we work with one of the local university in Malaysia, and then we sold off the company. So this is the first company that we established, and then we sold it off. So it really comes from waste. We're repurposing the waste to become something very beneficial, but not just beneficial. It's also protective towards our planet. So, and I continue the mission on looking at food waste on composting. So I realized in Malaysia, so most of my work are in Malaysia because I'm from Malaysia. So in Malaysia, we produce a lot of food, a lot of waste from agriculture. And this is one of the waste that we produce just from planting grass for cows. So there's a lot of waste that we actually produce, and we just need to reformulate this and then change it to something more beneficial. So we work with one of the, again, another university in Malaysia to really add the prebiotics and probiotics properties of this waste and then make it a sustainable feedstock. So they become a very nutritious food for the cows. And this is something that gear up to do it towards the low emission farming. So again, as a businessman that time, I look at optimization opportunity because I feel like at that point, innovation comes in a form of optimization. And I can make a lot of profit by optimizing farming. So we are looking at regeneration of land. So that's the thing. When we talk about addressing problems, we always need to contextualize it. In Malaysia, we have a lot of palm oil estate. And after 25 years, this palm oil estate no longer producing any palm fruit. So most of the time they just abandon part and then they are no longer being used. So what we did at that point is just to regenerate this palm oil estate to become a napier grass plantation, and then we use it to create a sustainable feedstock system. And then and after that, I also wanted to address the top 20% population. So the top 20% population, they really need a very specialized vegetable, kale, all this fancy vegetable that is not native to Malaysia. It's so hard to grow, but we built a lot of farms that actually try to grow all of this unnative vegetable. So what I did is that with all of this farm that's existing in Malaysia, they consume nearly 80% more energy as compared to conventional farm. So we developed an energy efficient system to reduce this energy consumption so that the energy production for this vegetable are not going to be as high as, as it used to be. And we also bringing the solution to the consumer. So this is the idea that we brought when COVID-19 hits. So when COVID hits, no one can move out from their house. So everyone's just stuck at home, right? That includes a lorry that sent all of the vegetables to the supermarket and everything. So what we realized is that the location of our farms to our neighborhood, community area are very, very far away. And that distance between farm and neighborhood actually emits a lot of carbon during transportation, logistics, and so on. So what we did is that we use a satellite data and then a market analysis data to really build a farm that is best located toward nearby neighborhood, and we plant the specific plant based on their market demand. So some of the neighborhood, they only want to eat lettuce. Some of the neighborhood, they want to eat spinach and so on. So that's what we call satellite farming, because we really harness the power of big data and IoT on this one. And finally, we need to have a very, very large food system. So when I talk about large food system, it's actually contradicting with what I said just now, because I wanted to have a very efficient food system. So it's not necessarily means larger. So when we really look into our recommendation, we really need to look into farmers. And I realized a lot of time, farmers are not a professional profession, including in Malaysia. They're not seen as someone, like white collar, blue collar, and so on. So what we did is that we tell them, do you want to be a smart farmer? So we upskill them with all of the precision technology that we have, and then we employ them to all of our smart farms. all of our farms that we built just now, like the Napier farm, the Datanam farm, and so on. So we upskill them, we develop a curriculum for them, and then we teach them. And then we use machinery, high impact machinery, and so on, just to understand what are the farmers' knowledge gap. And most of the time, sorry, if I go back here, we started by teaching them technology, but after 2 years, we realized that we miss one thing, one crucial thing when we educate farmers. They actually have problem accessing technology because they have problem accessing financing. And most of the time, they don't do any bookkeeping because all transaction happens in cash. So what happened after 2 years of sharing this curriculum with farmers, we added a syllabus called bookkeeping. We're just teaching them how to manage their cash so that they can have a proper record when they go to financing institution like banks and so on. They can just say, hey, I have this amount of money, I have this amount of asset, I need a financing to expand my farm. So that actually create a more access to all of this technologies you can see in this picture. So that is how I feel we can address food system. So I am speaking more on the earlier part of the supply chain system rather than on the consumer demand. So you can see that business as usual is no longer a viable option for us. We always talk about energy sector as one of the culprit in climate change, but actually it's actually as simple as food. Food actually has a lot of problems in our system. And in another part of things, we also can store carbon. So carbon footprint from food system is actually very, very big. We also can store them, but we have to be very mindful because you cannot capture everything and you cannot store it for so long. So one of the technology that we invented at the end of I missed a slide about carbon capture. But one of it is that we change all of our grasses, all of the waste to become an energy briquette. I think it comes after this. So again, what are the things that we need to actually address food system? The first one is to really look into reforestation. And then the second one is to really look into regenerative agriculture. And then finally, not sure. Okay, this one is carbon sink. This is the thing that I was looking for just now. So we change all of our waste from the Napier grass production into energy briquettes. So instead of them burning coal during winter, they are burning this energy briquette to warm themselves. So these are one of the things that actually going to be a carbon sink innovation, but it's not necessarily solve the problem. We still need to reshape a more healthier demand. But this could be one of the things that we actually innovating. And as you can see that since Malaysia, we don't really need to warm ourselves. In fact, we need to switch on aircon most of the time. We have already demand from Japan, Korea, and a lot of other green briquettes consortium to look into how to reevaluate what is energy briquette. So I think this slide summarized the entire presentation that I have today. So the first one is we really need to turn off the tap. We need to cut off the emission from food system by having efficient food system, protect ecosystem, and do emission farming, and then having a larger, more efficient food system. But then the last two is actually to remove carbon. So we have to restore ecosystem, we protect what we already have left, and also, start planting more plants, and then have a more idea on regenerative agriculture. The reason why we haven't tapped onto regenerative agriculture is because food is political. So a lot of time we don't want to explore that. Okay, sorry. But then food system is actually a very important a very important aspect of climate change. It addresses the biggest inequality in our current world. So the climate change impact food system in a way that it impacts the yield and everything, but it's also food system impact climate change. It's a bidirectional correlation. And you can see that the global syndemic of obesity, undernutrition, and climate change actually actually signifies the problem that we have with food system right now. So if you can see that the share of overweight and obesity around the world, it happens in a very large country, right? But then if you look into undernourished, it happens in a global equator country. But then if you remember the first graph that I showed to everyone, these are actually the country that produce all of our food, but then they are still undernourished. Yeah, right. So that's why I think I was honored to join Renzo in writing this paper. We are actually adding another actor in redefining who should actually change food system. We realized that in order for us to shape demand of food, we actually need to use doctors or healthcare professionals as the one who actually promote planetary health diet and tell them that you need to be more healthy and you have to be more more mindful about your food choices, because at the end of the day we always listen to our doctors rather than a lot of other, like our friends and so on. So, and we also look into operationalizing planetary health. It has to start from policy, and it grows like there's many layers, and then you can see that there's a few layers before it actually translated into something that is more common that happening on the ground. But this shows how complex shaping diet and food system in the overall scheme of things. And then, but we can see that there's a lot of example that's happening right now. When a hospital in Taiwan already have a more conscious representation of diet in their thing, in their menu and recommendation. And now we also have countries that are starting to include sustainability in their food recommendation and nutrition and dietary guidelines. Has Singapore done the same? I don't think so. Has Malaysia done the same? I don't think so too, because at this point, a lot of our dietary guidelines is addressing the issues of undernutrition or overnutrition, but we don't have the capacity to think about sustainability of our food. So finally, we have to look back into our ancestors. And I think Renzo famous statements like be a good ancestor. And I think our ancestors were actually very, very good. They have a very, robust traditional food principle that they only take what they need, but not take everything from the nature. And if we actually look back into our indigenous community, our people who doesn't actually affected by modernization and fast-paced lifestyle and environment, they actually have a very, very colorful and nutritious food. And I think this is where the future should be leading to. So I think that's all. The final remark that I want to say today: if you eat today, which I see a few of you doing right now, you should thank a farmer. Oh. Find a farmer in your neighborhood and then just say thank you. So thank you, everyone.
Thank you so much, Daniel. Let's give him a big hand. To all our online participants, please give Daniel an online applause. And you mentioned we need to thank a farmer. I'm reminded of another quote. I think it's from a German, philosopher. You are what you eat, right? Yeah. This presentation really shows to us the interconnections, right, between ourselves, the food that we eat, and Mother Nature. Thanks for giving a shout out to that phrase that I love saying. When we talk about planetary health, we need to be good ancestors for the future children of the world. But I think now I'm also realizing we need to listen to our ancestors, right? Because they actually have lots of age-old wisdom. For example, when it comes to consumption and the types of food that we eat and how to prepare the food that we will be consuming. This is a very rich presentation. I have lots of questions, points to highlight, and I'll, share some of them in a short while. I just want to encourage our online participants to please use the chat box for your questions. I'm seeing one hand raised, but please write your question in the chat box. I'll be reading it here inside the room. And of course, to our in-person participants, if you have questions, comments, if you have an experience to share, please, we have time for hopefully a vigorous discussion. Well, where to begin? And you already started giving some comments about the Singaporean food system, or even the food system here in Southeast Asia. You also showed to us what you're doing on the other side of the border in Malaysia. But maybe you can speak a bit more about the current situation of food, nutrition, health, and environment here in Southeast Asia. We here in SDGHI, in the SDGHI Planetary Health Initiative, Southeast Asia and Asia at large is really our how to say that, our arena, for action and for research. So you want to know a bit what's the situation. Is it promising or is it challenging? And maybe to connect it to the concept of the planetary health diet, how close or far are we from the planetary health diet? I know you already commented on the appearance of the food that we get from the kopitiams, certainly not as colorful as the photos that you showed. Happy to hear your thoughts on this.
I think, okay, I'm going to answer based from my knowledge dealing with the food, setting up a food company. One of the biggest challenges of making food system more sustainable is that sustainability is not yet our main focus. The challenge of food system now is to access the needed most. So like a lot of time in Malaysia, there's a subgroup of a population who didn't even get proper nutrition. And because of that, accessibility of food actually gonna make a lot of people do not have the capacity to think about having a plate that is very colorful, very robust, and so on. And that is something that we need to have, we need to address. So the second one is that how far are we from planetary health diet? There's a lot of other factors that actually look into into achieving this planetary health diet. One of it is our cultural difference. In this region, there's a lot of culture, there's a lot of type of food, there's a lot of type of cuisine and so on. And maybe this cuisine is not as colorful as planetary health diet. And that's something that is very arbitrary. So we don't know how far are we from our planetary health diet goals. And the third one is really looking into costs of planetary health food. So when we talk about plant-based diet, a lot of time plant-based diet is more expensive than having animal-based protein. And this is because of a supply and demand aspect of it. And like animal protein is generally a little bit more cheaper and accessible over here as compared to plant-based protein. And that is something that we know that shaping and demand could be very challenging. And then the final one is also educating farmers. And a lot of food businesses around this region, they still have problem accessing funding to generate innovation internally. And that's why a lot of time we don't really have a very innovative food companies over here. And that's why sometimes we just follow the trend. So I think that's the answer for your question. So,
thank you. And that's certainly very comprehensive. You started touching on this as well. you mentioned about the cost, and maybe we can explore a bit about how to fix the economic aspect of this. But also, in the presentation, you mentioned about, the growing movement around producing these, you described them as fancy vegetables like kale, and it's the more privileged parts of the population that are demanding for this, that are accessing these products. And I wonder if innovation now for food tends to focus on these products rather than those that will benefit the bigger part of the population. And in this, and in this manner, are we even exacerbating the inequity that we have when it comes to the food system and the distribution of nutrition and good food across the population? So how can we make sure we don't exacerbate the very problem that we're trying to solve because of our myopic attention on the fancy food?
Yes, correct. I think, thank you for highlighting that, because like when we just focus on the fancy food, we really don't pay attention to the basic needs of nutrition for the population. And I think innovation actually grows from both ends. We also see innovation happening at the at the starting point of the supply level of food system, and also at the very unique demand of food system and so on. So we can see innovation happening in aquaculture. There's more technology being invented to have lobster being grown in a building and so on. But at the same time, we also have innovation that's happening from how to distribute food better, how to actually identify communities that need supplementation and so on. So this, if we identify all of this innovation in food, we actually can see that it's in a spectrum. But obviously, because the money is over there, right? So most of the time, funding happens to the innovation that actually have the most biggest demand. So that's why we can see that it actually serves to the food that is have a better demand, and most of the time only going to address the food demand for the middle to the top population.
Thank you, Daniel. I now have 3 questions here in Zoom, and they're actually quite interconnected. So I'll try to kind of combine them. 2 of them look at are asking around a question around plant-based diets, but 2 of them also asking about the hospitals. So from Norma Tagaza, who's a dear friend from Heidelberg. Good morning, Norma. Thank you for always joining us in our monthly conversations. She just had a meeting with a nutritionist in a hospital in Germany. So it's not only an Asian problem. The Europeans are experiencing this. It's a global challenge. And she's saying that there's no conscious effort, no policy to reduce meat-based diets or to increase plant-based meals for patients. So any ideas on how to promote dietary changes among, quote unquote, she uses this phrase, hard-headed hospital management? Another question in relation to that from Shin Ying Yam: how can hospitals be at the forefront of promoting a more planet-friendly diet for patients, staff, and visitors? You showed us, the paper that we co-wrote, which touches on this. So maybe you can elaborate. You also showed one example from the Chuchi hospitals in Taiwan, but maybe you can elaborate. And then, because the question is also about plant-based diet, another question: how can plant-based food be more attractive to consumers in terms of cost? But again, maybe the answer is, let's start with the patient in the hospital, then maybe later on it will spread. Any thoughts on these questions?
So I think it, like I said, it's bidirectional. So if you want to make hospitals be more proactive in promoting planetary health diet, we also need to educate the healthcare professional to understand that planetary health diet could be in par as the traditional diet recommendation that we have currently in the dietary recommendation guideline. But most of the time, it stems out to dietary recommendation guidelines. So a lot of time we refer to that Bible food Bible to really look into what we're going to recommend to our patient. So that's why hospitals very slow at adopting it because it has to be clinically evidence. At this point, we don't really have a lot of work happening on identifying what's the clinical effect of all this planetary health diet, towards patient and people who already have established diseases. So, but for healthy population, you are free to choose. And in fact, you can see that there's a lot of data showing that calories very limited over there, high fiber, more color, more vitamins, and so on. And we need to address this, population, which is obviously bigger than the disease population. And the reason why I mentioned just now, healthcare professionals should be our agent is because they are the one that make a lot of our recommendation. And most of the time, when they go out, they'll be like, "Oh, doctor, can I know what should I eat? I don't have energy tomorrow," or so something like that. So if the doctor recommended red meat as the first line of recommendation, that could be problematic. So that's why educating healthcare professional on planetary health diet could be one of the solution for it. And I think the reason why policy is not available just yet is again because of the clinical recommendation. We don't really have evidence to it. And another thing, hospital is similar to any other businesses. The cost of really buying plant-based food could be more expensive than the normal conventional diet. And that also explains why we are very, very slow to adapt planetary health diet. And at this point, hospital could be one of the best agent to promote it, but at the same time, the planetary health diet also have to be available and accessible to the mass market. Yeah, I hope that answered the three questions.
Definitely sufficient. And I agree with you when it comes to educating our health professionals. There was actually a study in the United States, majority of American doctors, and I think it's the same everywhere, not equipped to provide guidance and adequate guidance on nutrition to patients. We tend, I'm a physician and I always just say, oh, eat healthy food. But what does healthy food mean? We need to be more detailed. We need to be more granular and specific, but we also need to start incorporating sustainability. And that's why, 2 months ago, in our inaugural planetary health course here in Duke-NUS, we included food and sustainable food systems as part of the curriculum. And of course, Daniel is our guest speaker. So thank you, Daniel, for your service. But also, and this is for the researchers in the room, but also joining us online, you mentioned the evidence is still limited and it needs to be further strengthened and enhanced. Our friends from Chuchi hospitals in Taiwan, they have in fact a paper showing that plant-based diets reduce cataracts among patients in their hospitals. And we need more of that evidence. In a way, we know and we can anticipate the health benefits, but we need to show it through empirical research. And so I encourage the researchers here that this is another new area and arena for inquiry so that we can support the generation of policies and practices that will promote healthy and sustainable diets. So thanks, Daniel. I'm seeing more questions here, and I also would like to invite colleagues who are in the room. Please signal to me. Introduce yourself very quickly, and then your question.
Hi, I'm Nurul. I'm a research associate. I'm a research associate at SDGHI. I do have 2 questions. More to understand the process that was undertaken throughout your journey. How was collaboration? How do you collaborate with different sectors in your journey to innovate and to finance startups like this? And secondly, there's also the issue of livelihood of farmers. So when converting conventional farming techniques to innovative farming techniques, how do you then take into account the livelihood of farmers? You mentioned upskilling as one, but also some of the farmers I encountered, they are actually older folks who has been in farming for multi generations, and they're considered informal sectors and do rely on the maybe the businesses in agriculture rather than them who's actually being paid for this, but rather they are just employed to farm.
Yeah,
So
great.
then how do you
Yeah.
convert that?
I'll answer the second question first. I think when we meet a lot of farmers in Malaysia, because my context is Malaysia, right? Most of the time they're old and they're very seasoned, but even themselves don't want their next generation to be a farmer. Yeah, most of the because they see it as a non-sexy professional. So that's why in our upskilling effort, we don't really only include older, more seasoned farmer. We include younger generation to tell them, hey, farming can be sexy, and farming can be profitable, and most of the time they want to see fancy thing like a dashboard with carbon emission, dashboard of drone and so on. These actually make farming and like farming technology become more attractive to the younger generation. And that's how we actually slowly incorporate those things. And then when we see that there's more interest in the younger generation, who then translated to their parents, and they were like, oh, okay, this is not really farming, it's engineering, but it's actually farming. Yeah. So on the first question is on how do I address collaboration and so on. I think the first thing that I did with also my startup group and so on, we identify what value we want to bring to solve a problem. So in our question at that point was, how do we revolutionize agriculture, and what do we have in our bucket to solve this problem? So after identify the value, we identify the gap, and within each gap we find a collaborators to work with us. But we really need to map out everything on a large piece of paper and to understand who to collaborate. Because most of the time, collaborators might come to you just because they want some publicity, or they want to get some money from you and something like that. But if you know what you're bringing to the table, and you know what they want to bring to the table to solve that one problem that you want to solve, then that's how you can collaborate with them. But most of the time, it has to benefit both organizations. And a lot of time I see a lot of startups, they only look for financing because they want financing, but they don't know what value they bring to the organization that financing them. So that's the mistake that we see a lot of failed collaboration happening. Yeah.
Yeah. Thanks. Just a thought came to my brain. One proof that you're doing collaboration well is when you begin using the language of the other sector. So, I forgot to mention, and maybe you failed to mention also, Daniel started as a nutritional epidemiologist, but he now, speaks and sounds like, an agriculture, expert farmer, but also an investor. He's very familiar with the space of entrepreneurs, innovators, and financiers. So that's a good sign. And for us in a medical school and in an academic medical center, of course, we need to collaborate with colleagues from within medicine alone. There are already so many disciplines, but even beyond, right? That's the challenge. If we want to improve nutrition while at the same time protecting the planet, we cannot just stay within our own backyard and be comfortable in our comfort zone. So thanks, Daniel, for those lessons. And I also appreciate your response to the question on the farmers. And you mentioned a while ago that your upscaling programs, the financing, literacy that you provide them. We really need that holistic approach. Unfortunately, many farmers, for example, in my home country, the Philippines, they are the ones that are the hungriest, right? They have the least access to the food that they produce. So we really need to fix that. And if our farmer is not only not thanked, but also hungry, then something is really defective in the food sector. Which I think goes to a remark that you mentioned, but you did not elaborate yet. You said food is political. And in fact, whenever I talk about food, I have this slide showing that only 10 multinational corporations govern the entire food system. So when you go to the supermarket, the grocery, you'll see so many brands, but actually they're owned by only 10 companies, because a company has hundreds of brands.
Yeah.
And they influence food policy making, they govern the food system. They're even in COP29 now in Baku, lobbying for their interest in the climate negotiation. So maybe you can speak to, in a way, how to navigate this complex political food system. How do we address the political and the commercial determinants of health and food and climate?
Oh, sure. So I think for the reason why I say food is political is because there's a lot of political barriers that I faced when I did my work in innovation for food system. One of the things that we soon realized after I think 4 years on doing this is that, so I'm just going to use a little bit of business term here, but then in food, there's a B2C, business to consumer market, where branding works the most. You will hear all of this famous brand and so on that actually provide food to the market, and for instance, instant noodle is not called instant noodle now, it's called by a brand, right? Yeah, so that is why it's very hard to penetrate that segment. And that's why we actually segue to innovation of the supply chain. We wanted to look into the raw material, look into production phase and so on. And that is where politics involve a lot of time, because you need land acquisition. And a lot of time land is owned by the state government. And if you tell them that, hey, I want to build a farm, they'll be like, oh, I'm going to sell it to a property developer, something like that.
To build a casino, for example.
Yeah, but not for Malaysia, but then maybe Philippines, But and those are the factors that actually limit the growth of innovation in this food space, because we have a lot of resources that's governed by a lot of teams that interest by by the political leadership at that point. And these are the things that it also trickled down to the grant that we want to apply. So when we want to apply for financing, for grants and so on, they have a specific team that they want to invest in. And most of the time, it was advised by people who has power and already established in the market. So I think food is very tricky because it plays with the basic need of human, but then it's not impossible to innovate. You just need to find the loophole where you can optimize the entire system. So if you know that that particular segment is very hard to innovate, then move to something a little bit easier.
And actually, in terms of dealing with the industry, corporate actors, we know there are companies that are off limits, right? Global regulations and norms already say we cannot be in speaking terms, for example, with tobacco companies. But for the food sector, one phrase that is usually used to describe them is they're in the gray area, right? Sure, they produce the junk foods, they produce all these bad options, but as you mentioned, food is essential, right? And there are also actors that produce the food that we need. The food that is nutritious, the food that will help us, live and survive and thrive. But now we need to also, negotiate, deal with them on how to reduce their environmental footprint, but also improve the nutritional quality of the food. So that we fulfill both the environmental and the health objectives of our societies and countries.
I mean, if I can add, that's also a room of collaboration. Rather than seeing them as an enemy, you can actually knock on their door and collaborate and really understand where they want to improve. And one of the, for instance, the Datanam, one of the company that are focusing on precision agriculture that really look into this specialized vegetable, we actually knock on big brands who actually market this food in Malaysia and then tell, hey, we have a more energy efficient, it reduces your cost, and it's climate friendly. Do you want to explore this? And most of the time they are open because they are also having problem optimizing their cycle. So if you have a solution, don't ever see anyone as an enemy, just collaborate.
Yep.
Yeah.
Yep. So we only have 5 minutes remaining, and one small, not small, one important aspect that we have not touched on yet, because of course the food system, it's unevenly distributed, right? The products of it unevenly distributed. Some are over consuming, some do not even have access to it, and then it's creating or contributing to the climate crisis. It has its own environmental impacts, but it's also highly vulnerable, right, to climate shocks and stresses. There's a typhoon, there's a flood, and entire farmlands can be destroyed, and that means more food insecurity, also less economic security for farmers. Any thoughts on what should we be doing to make sure our food systems are also more resilient? You mentioned about rice. In the Philippines, there's the International Rice Research Institute, where they do a lot of research on flood resistant rice, typhoon resistant rice, disaster proofing rice, right? While at the same time making sure it's nutritious. So any thoughts on how to make food more resilient?
So I think the resilience of food comes from the food system itself and also from the user. So food system could be resilient if the user makes their diet more, has more food option in it.
Diversity.
So diversity in food. So for instance, in Asia, we can opt for rice and we can also opt for noodle and so on and something like that. But then in the case of disaster, for instance, in Philippines and so on, we also open to other options. And that's actually increase our resilience towards diet. But resilience toward food system is defined differently. And that actually talk about, disaster-proof farming. And that is a theme that has been in discussion for, I think, at least 28 years. Because FAO has been looking into how to make Philippines more food secure, because there's typhoon every day in Philippines, I think, and then there's earthquake every day in Nepal and so on, and that actually requires innovation. That's where we have not innovated enough, because we are innovating at the mass population, but then we are not innovating at disaster-prone areas.
And how to go beyond reactive measures, right? There's a typhoon, okay, we collect, food supply and then distribute it. So it's a big question, and it's an arena for research as well. Finally, you mentioned already innovation so many times. You've mentioned data. What's the role of artificial intelligence for the future of food?
A lot. Data feeds artificial intelligence. And a lot of time, artificial intelligence predict what we want. And then it predicts what's going to happen to our weather. And this is where disaster resilient farming could actually leverage on. And artificial intelligence also can be one of the things that we use to refer. Nowadays, we ask ChatGPT for everything, right? But then ChatGPT could be wired onto something like, hey, what's healthy today? Planetary health diet, something like that. So that could actually be one of the facets of artificial intelligence. From my capacity and based on my experience, we only use artificial intelligence to predict the fertilizer usage, the area farm that we want to cover, type of food that we want to grow, and so on. So we are looking into, I am looking more on the supply part rather than the demand part. But artificial intelligence obviously will have some impact on the demand, shaping the demand of food. But that could be some area that we need to explore a little bit more.
And even the demand side, you already inserted it, thinking about how to reshape people's preferences, consumption behaviors. That's also another research arena which will benefit from example from psychology, behavioral sciences, etc. Wow. This has been a very rich conversation. I think we are also nourished, right? Well, no pun intended, with new knowledge and wisdom and ideas, for future research and for, future action. So thank you, Daniel, and let's give him a big hand again. Thanks also to our both in-person and online participants. This is our final conversations in Planetary Health for 2024. We'll pause for a bit, but we will come back in 2025, which is in a few weeks' time. So please keep abreast of updates from SDGHI, and we hope to continue the conversations as we, co-imagine futures, co-design solutions, and implement and deliver innovations that will advance the health of people and the planet. Again, thank you very much. Happy holidays and happy new year, and see you in 2025. Take care.